you. Good evening. I'm very excited to be here this evening to share with you the research that we've been doing to advance our understanding of COPD at St. Paul's. So many of you may have heard of COPD, or chronic obstructive pulmonary disease, in the news. COPD is a global burden that's affecting all societies around the world. Now, importantly, COPD is the only chronic disease that is still increasing in prevalence. And as you mentioned, if we bring it home to Canada, if we look at COPD hospitalizations alone, this is costing $1.5 billion per year. Now, many people ask me, what is COPD? And really, it's an umbrella term we use to encompass several lung diseases, which include chronic bronchitis, which we also call smoker's cough, emphysema, and small airways disease. Now, we know from population-based studies that exposure to smoke, whether that be cigarette smoke, secondhand smoke, smoke in biomass fuels, or occupational exposure, is the major cause of COPD. But we also know that age, our genetics, other respiratory diseases, and the pollution within our environment are also important risk factors. Now, when someone has COPD, what it really means is that they have difficulty breathing. And in clinic, we measure this as their lung function. Now, for those of you in the audience that are most likely over 25, as we age, just like our skin ages, the organs within our body also age. And so by the time we reach 75 years, if we're a non-smoker or a non-susceptible smoker, we'll lose on average around 25% of our lung function. However, if we're someone that's susceptible to smoke and develops COPD, we will have a much greater decline in our lung function. So by the time this person is 50 years of age, they already have shortness of breath, and unfortunately, they'll rapidly decline to early premature death. Now, we know that if people stop smoking, we can slow the progression of the disease, but we can't enable that person to regain the lung function of a normal, non-susceptible individual. So you may say, well, it's easy to cure COPD, stop people smoking. But the problem is, the baby boomer population, which are now reaching 55 to 75 years of age, which is when COPD is normally diagnosed, they grew up and lived their whole life in an environment when smoking rates were at their highest. And really, it was not understood until the late 70s that smoke exposure could cause diseases like COPD and cancers. So thankfully for British Columbians, St. Paul's has been investing in research into COPD for the last 40 years. And this really started with the recruitment of this man, Dr. James Hogg, who was an eminent pathologist in COPD. And he really understood the importance of biobanking disease tissues and using high imaging technologies to research those tissues to visualize the disease. The center now, which is called the Center for Heart-Lung Innovation, is 280 strong, with clinicians, scientists, and students all working towards solutions for heart and lung disease. And importantly, the two biobanks we have for heart and for lung are now world-renowned and are an important source of collaborations, which leads us to be first in Canada and third in the world, only behind Harvard and Imperial College London. Now, Dr. Leitzig has shown us the advances in radiology that are really pushing medicine forward. And if we use a thoracic CT scan or a chest CT scan, we can now non-invasively image the airways within the lung within a patient. However, if I overlay a resin cast of the lung, we can clearly see that clinical CT doesn't yet have the resolution for us to image the whole lung and study it to look at disease. But thankfully, due to funding from you and the Foundation and Canadian Foundation for Innovation, for the last 5 years, we were able to invest in a micro CT scanner. And as shown here by the video, this has really enabled us the ultra-resolution capabilities to image human lung samples and now visualize all small airways shown here in pink and the alveolar units, which are important for gas exchange. Now, importantly, using this micro-CT scanner and the lung registry, last year we were able to publish the study, which showed, where we have in white, we compared control healthy smokers, and we showed that if we look at patients with mild and moderate COPD, they've already lost 41% of the small airways within their lungs. And this further declines to a 68% loss in patients with very severe COPD. So this study is really changing the way we think about COPD. Current guidelines suggest that for mild patients, they should receive no or very limited treatments. But we've clearly been able to show that there's massive destruction within the lung, and we need to treat these patients early. Now, importantly, if we're to do this, we need to look at these small airways and understand what's going on in the tissues. So really, for the last slide, I want to share with you some research that I've been doing for the last year. This is really kind of about due to a new innovation, a new technology called CytOff, which is now enabling us to image every single cell within a tissue. And to demonstrate this, I'm showing you the colored dots here are actually showing you all the different cells within a tissue. Now, currently, there are only one of these machines in Canada, and it's based at McGill. And so through collaboration, we're already starting to understand how the cells of the COPD patient within their immune system are migrating into those tissues, how they're interacting, and how they're causing tissue destruction. But ultimately, these types of technologies are going to be the technologies at the new St. Paul's and the new imaging centers that are going to be essential for us to understand how these tissues are being destroyed and how we can develop treatments to treat them. Thank you.